Hey, y'all, welcome to another episode of the Confessions of a Male Gynecologist. And this month, the month of December, I am interviewing all four of my children. Last week, you listened to my oldest and only daughter, Hannah. This is my oldest son, Hunter. And Hunter currently is 27. I got that right, didn't I? 27. You lose
As far as
count.
I can
You
remember,
lose
yeah.
count. I think after 23, it all goes to hell, anyways. 27. He lives in San Antonio, so he's close by. He's in med school right now. He's going to be the only one of the four that actually decided to go into medicine. And I want to thank you for coming on. Hunter is not my conversationalist, so and then again, neither am I. So our phone calls are always pretty fun because how you doing? Fine. What you doing? Not much, but it's good. So hopefully I can get you chatting here. We were just talking before he came online. He's currently in medical school, and you're currently on peds rotation.
Yeah, I'm doing pediatrics right now.
And I remember the first week you were on, didn't you get sick?
Yeah, I think I started and then I started to get sick that Sunday, the Sunday after I started, and was sick for a couple of days. I was pretty convinced that I was going to be all right, but I was working at urgent care for the first 2 weeks, and so I was just seeing sick, like 40 sick kids a day, so it's kind of inevitable.
Yeah, I mean, the kids are like literally walking petri dishes, and if you haven't been exposed to those bacteria before, that's why I think being a doctor, it's like your immune system has been exposed to like so many things. So Hunter started. He was born in Oklahoma City during residency. Let's see, that would have been 96. So I think I was in my third year. And you were actually born, interestingly enough, you and your brother Angelo, who I'll talk to next week, were born in the same hospital. And also, the interesting note, the same hospital where my mom died, your grandma died. So really kind of an interesting side note there. Um, Angelo and you and Hannah are like 2.5 years apart, 3 years apart, and then there's 6 years in between you and your next brother. Um, the divorce, when I divorced your mom, gosh, you didn't even speak yet. So I doubt you remember much of that. But do you remember living in Edmond, Oklahoma in that house? Do you have any memories of that?
Kind of, but not really. Like, I know that I have memories, but I can't really like visualize them, if that makes sense. I think most of the memories that I have are just from pictures that I've seen. Like, no, I don't remember the neighbors that lady that was our neighbor that used to watch us and
Yeah,
stuff.
yeah. I didn't even remember
But
that.
I kind of remember her dogs and stuff, but it's not anything very like vivid. Most of my memories from Oklahoma are just in Chickasha.
Oh yeah, Chickasha. I forgot about that. We lived there for a couple of years. That's right. And then you moved to Tucson right before I want to say before you were starting kindergarten, because that was even before Hannah started kindergarten. And you went to it was kind of like wasn't in Marana. It was technically in Tucson, but you went to a place. Do you remember the name of your elementary school?
Uh, my elementary school or like the daycare
Kindergarten.
kind of place that. I think I did first grade at Coyote Trail, but I think
Yeah.
kindergarten was at some like church. I went to some like church facility before that. I remember.
Oh, that was it.
Well,
Yeah, in Tucson, that was a daycare, but you went to kindergarten. You went to kindergarten at Coyote Trail, and there was a day that they had the um, like bring your parent to work day, and so I came in and was talking about delivering babies and stuff, and then you raised your hand and said yeah, and you said hey Dad, remember when you told me that girls had vaginas? And I said, "Yep." And then that's all. That was all you wanted. Um, and the teacher quickly changed the topic, as it were. So you went through Coyote Trail, and then you moved with your mom out to Vail, Arizona. But you shifted over to me. I want to say, was that like sixth grade for you? Orange Grove.
yeah, yeah, I was right before sixth grade started.
So you came to live with me and your stepmom Katie in the sixth grade, and you went to Orange Grove Middle School and then Catalina Foothills High School. And I will say, out of the four children, Hunter is probably the one I would give the most adaptable, because we decided right before his senior year to move to Austin, and the poor guy had to move in between his junior and senior year and leave all of his friends and go to a different high school. Do you remember, was that particularly traumatic for you? I mean, you're hard to read sometimes, so you seem to be pretty open to the concept, obviously, but do you remember that being particularly difficult?
Uh, Not really. I wouldn't say difficult was a word. I really didn't think I had like any thoughts or feelings towards it, to be quite honest. I don't know if that was just, like self-protection or whatever, but I wasn't really afraid or I didn't really have any negative thoughts toward it. I just, if anything, I think was maybe just bitter about living in Tucson and thought it was boring, and so I wanted to go explore something else. Um, so yeah,
Yeah, it was pretty
but that
fascinating.
was,
You moved and you fit right in. I mean, almost immediately at St. Andrews. Here in Austin, I think you still have some really good friends from both places. That's why I'm saying you're quite adaptable. But the interesting thing was, you went back to Arizona, Tucson, the place that you said you didn't particularly love, to go to college there on a full ride. Lucky you, you did well enough to get the ultimate scholarship. But what did you majored in neurosciences? Why did you pick neurosciences?
so I was kind of trying to decide. I think when I first went in, I think I was maybe a psychology major at first. Um, and so, but then I knew I kind of was starting to develop an interest in philosophy, so I thought about majoring in that. But then I was also kind of, interested in neurobiology too. I think mostly what I was interested in was just kind of, exploring myself, trying to understand myself, and then I started to develop kind of an interest in consciousness and sentience and humans and stuff like that. And so I looked at neuroscience because I'd always wanted to go to medical school. And then within neuroscience, I found that I could do neuroscience, and then we had to pick an emphasis. And one of the emphasis I could choose was philosophy of mind. And so I was a neuroscience major that focused in philosophy, and then I also minored in philosophy. So it kind of allowed me to easily mix my interests and make sure that I was meeting the prerequisites that I needed for medical school while also be able to study like humanities stuff that I was interested in.
Yeah, so it was a really interesting course. I think that you took. I mean, pretty fascinating topics. And then you were also a TA for organic. Was it organic chemistry?
Yeah, I was a TA for organic chemistry, and then I also was a TA for on like a neuroscience research methods course.
Can I tell you that organic chemistry was literally my least favorite class ever? In college, I had a priest that taught it, and I hated every second of it. So it doesn't always matter what your kids want to do; they end up doing or that what you did. But like I remember, so I'm 5'9". Your mom's about 5'4", and when you would ask Hunter when he was a kid, probably 5 years old, what he wanted to be when he grew up, he'd say 6 feet tall. And I was like, well, that's not something you can be. And he kept saying it, and somehow you ended up being like 6'1", 6'2", and everybody else in the family. Anthony's 5'8", Angela's probably 5'10", 5'11". I still really have no idea how you did it, but I think it was just sheer will to power, as it were. So congrats to you. It just shows you can do whatever the hell you want if you put your mind to it. Um, so you majored in neurosciences or philosophy?
I majored in neuroscience and then minored in philosophy.
So who's your favorite philosopher?
Mm,
If you're ever at our Thanksgiving table, he's always talking about some
yeah, I don't
freedom to
know if I'm
choose.
really like. I wouldn't say I'm well versed enough, like well read enough to have like, a favorite philosopher. I think my favorite topic in philosophy was free will,
Yeah.
and I read a paper by this professor. He used to be a professor at UT in Austin, named Robert Kane, and I just really liked the way that he conceptualized free will in humans, and that's kind of something that stuck with me was just his paper. So I'd say that's maybe my favorite, but um,
So the
I think
question
there's a
then
lot more
begs is,
readers too.
do we have free will?
I mean, I could drone on about that for a
Go
while. I
ahead.
think just
Tell me. I don't know. I personally believe that we do because we can do whatever we want. I mean, you could
yeah.
choose to take a nap. You could choose to, you can, I mean, there's all kinds of things we choose. So is that not free will?
Yeah, I mean, I think it just depends on how you define it. I think a lot of philosophy comes down to the definition of words and what you mean, and a lot of times people speak past each other. But I think I flip flop a lot on kind of that. I think there we have opportunity for free will. So I think it's something that's accessible to us. It's just hard to access, and I think that most people are just kind of operating on autopilot. So we're not really choosing what it is that we're doing. You know, we have all these, external forces that are influencing us to act, and genetics and childhood. That's kind of, I look at it as kind of like a weighted network of, we have maybe certain options open to us, but there's a 70% chance that we'll do A and a 20% chance that, or and a 30% chance that we'll do B. And most of the time it doesn't matter. Like, it doesn't matter what you eat for breakfast. So that's not really a decision that you're making. It's just kind of occurring, in my opinion. But I think like big life decisions, like me deciding to go to medical school, I have a lot of time to sit down and think and deliberate about that. So I can maybe have more free will because I can kind of balance those influences on myself to make a decision. Um, but I think, a lot of times we're being influenced by our emotions and we don't really have control over that. And I think the record, like one thing that you really need to be free is you need to have like a really good sense of introspection and understanding of yourself. And I don't think a lot of people have that. And even if you do have that, I think it's harder to like auto correct your choices. Um, but I think you can kind of like over time, you develop your character as a child, and then as you get older and you have more of an understanding of yourself, you can kind of, I think, at some points, kind of change that character a little bit.
Mm.
And so you can kind of like guide yourself to become somebody different, but you're always going to revert back to that base that you have. So it has to be something that you're actively working towards every day. And I think a lot of people don't do that. So a lot of people aren't free in a sense that I think is important. But then I think at the same time, it doesn't really matter because it doesn't matter if we're free or not because we feel like we're free. That's just kind of programmed into us as our species. We're programmed to think that we're free. Um, so even if I don't believe that I have free will, I still feel like I do. And then also I think that free will is conceptualized in terms of moral responsibility. So in terms of you know, blaming people for doing something wrong or praising them for doing good things. And I think that from a societal perspective, we need that, there needs to be a way to hold people accountable. And so we have to kind of have a belief in free will for that to be possible. And you can argue that, and there's philosophers that argue against that, but I think those are just kind of some points that are important.
So when you mentioned for a minute, you mentioned medical school and the choice to go to medical school. And a lot of
mhm.
people will say, I think myself included, when I went to college, that's kind of what my goal was. And you you kind of followed a similar path because I didn't get into medical school my first year. You know, you have to take the MCAT, and which is the entrance exam, and I suck at those standardized tests. So I had to take that stupid test 3 times. But when you got out of college, and I don't remember this timeline, did you apply to medical school right out of college?
No, so if I would have applied right out of college, I would have started to apply in like my last year of undergrad, and I didn't want to do that. So I kind of took that time off. And then I started applying kind of after I had already, that my first year out of college is when I started my first time.
And did you get in you didn't get in the first year you applied?
No, I got one interview to University of Arizona in Tucson, but I guess they didn't like me. So
But that was
I actually
during
think
that was
I
COVID.
reached out to them. No, that wasn't during COVID. That was before. That was like right before COVID,
Weren't
I
they
think.
doing these weird didn't they put you into these mock situations and ask you how to react?
Yeah, yeah. So like one of them, I won't tell you that one because it's kind of political, but the other one I was put
No, but
into
that's why they
something that
do
was
it.
like,
That's why they do it. There is no right
Yeah,
answer. At least I sometimes don't think there is, but they think there is, and that's what makes it tough.
yeah. I don't necessarily think it's about. I don't think there's a right answer per se. I think they just want to see how you like work through conflict and think about things in real time. But I think I reached out to them and asked them like what kind of happened with my interview, and they told me that apparently I lacked critical thinking skills and cultural competence. So I thought that was kind of funny, but
Yeah, that's pretty brutal assessment to tell somebody. When I
I don't
didn't
really
get in,
believe I don't agree with either of those two things. But
yeah,
I guess
and that's the thing though. You are basically waiting on the judgment of probably two or three people, and that's it. And that's who makes the decision. And it's they got to have their system, I guess. But that's why you made that comment about free will when you go to medical school. It's like, well, if you don't get in the first time, you're kind of faced with this choice. What do I do? Do I reapply? Do I decide to do something different? And I think you were probably justifiably frustrated when you didn't get in. Um, but then you ended up working at the hospital where I work for surgery, and you ended up helping to clean operating rooms. Do you feel like that helped solidify things for you about medical practice, or that made you want to do it more? Or what kind of stuff did you learn cleaning operating rooms?
well, I wouldn't really say it had like an impact on whether or not I wanted to continue going to medical school or not because I just don't think it influenced me in that sense. I think more so what it gave me was just like the opportunity to learn about people, people from different walks of life. A lot of my coworkers came from very different backgrounds than me. You know, a lot of them
Mhm.
like less fortunate, I guess, and just came from a different socioeconomic bracket than me. And so I kind of learned a lot from them, just in terms of a lot of things that they had to kind of work against and the struggles that they faced to get to where they were, and the accomplishments that they achieved. So I think I just learned a lot about people in different walks of life and different ideas of what success can look like and success can be. Um, and so I think that's kind of what I learned from that. And then I also learned a lot from just kind of listening to the doctors and the stuff that they talked about and the stuff that they dealt with from like a business perspective, which I think is something a lot of students don't get before they start medical school, and that's something else that's kind of stuck with me as I've gone on.
Do you find that did it influence you at all to have a parent and a step parent that were physicians? Or do you think that actually maybe showed you, I don't know, the reality of it too is that while it's great, you have job security, you make a good income, you have some prestige that's debatable, I suppose, anymore, but it's a good lifestyle, obviously. Do you feel like it also showed you the negative side of practicing medicine?
Uh, yeah, I mean, definitely. I think
Or are there any? Are there any negative sides? I mean, running your own business doesn't matter, I guess, if it's a medical practice or a restaurant. It's tough, it's definitely tough. And your stepmom's in a big group, and I'm kind of by myself. So there's different things here to look at. But let's go back to not getting in. Um, what did you do anything different after you didn't get in, or did you just kind of jump through the same hoops and open your mind up to more possibilities? I mean, because it's a pretty big no, because I had the same thing. I didn't get in my first year. You had better grades than I did, but the competition is, I don't know the number of people applying to each school, but it's got to be in the thousands for 100 positions or whatever. So the it's tough. And I'll be perfectly honest, as a white male, um, you don't have any other favors that are attached to that. You have to be, like you said, you have to be mentally competent and all the other things, as do all the other applicants. But we didn't have you know, the other things to claim on an application. So a little different to think that you might not get in and somebody else gets in that is essentially has the same qualifications. But anyways, did you do anything different, or did you just say, well, I guess I'll just try again? Did you change certain parts of your application? What did you do?
think I changed a whole lot. Maybe I should have, but like I didn't. I might have changed my essays a little bit. Just try to clean them up a little bit, make them a little bit better. I think I applied sooner than I did the first time, just within like the cycle. Instead of applying in September, maybe I applied in August, just to kind of, because most of them are rolling applications. So if you don't get in during one time they look at it, just kind of they'll keep looking at it. So the earlier you get it in, the better typically. The only thing I really changed was I took the MCAT the second time. So I think the first time I took it, I didn't really study for it, and I was like a 50th percentile score, so about average. And then the second time I took a bunch of practice tests. I think I took probably 8 or 10 practice tests before I took it the second time, and I went and got an 80th percentile score. So it was a pretty significant jump. I'm not sure how big of a difference that made, because the second time I applied, I only got in. I got a couple more. I think I got 3 more interviews that were from DO schools, and I got interviewed by the University of Arizona Tucson again. So I probably should have changed my application more. I just didn't. I also didn't. I know some people use services to like help them, professional people help them write their letters and
Hmm.
kind of curate a story. But I didn't do that, and that's probably, if I can go back, that's probably something I would do, is like pay a service to help me kind of curate a story and polish my application, because I know that's
Well,
something I
I
want to do.
also don't. I feel like that's too that's kind of making you into something though that maybe you're not. Like, I think your attitude is, this is me, and if you don't like me, then I can't really change that. I mean, you could go to somebody that's going to polish the edges and whatnot, but really, you can't go in there if you're not this kind of like, hey, everybody, how's it going? Check me out. If you're more subdued in the way that you respond to things, that can be taken. It's really hard to have your whole potential career and last 5, 6 years of your life hinging on a 30-minute interview. I mean, you might say one wrong thing that this person doesn't like, and you just go down the drain. So it's obviously pretty stressful. So I guess you got into a DO school. You mentioned DO, and I think people nowadays are definitely understanding that doctor of osteopathy versus medical doctor training's pretty much the same. But what's the difference between an MD and a DO?
Uh, and then I think there's like a marketing answer to that, and then I think there's a more pragmatic answer, and I think there's kind of a historical answer to it too. So I guess I'll kind of give a couple of the different ones. I think typically the generic answer you hear is that DOs they're holistic. They don't just treat the disease or the symptoms, they treat the person. And I think that used to be maybe more so unique to DOs kind of back in the past, but I think nowadays medicine as a whole is becoming more and more holistic. Um, I think we're starting to realize that there's a lot of things that influence disease in people. And so I think MDs and DOs are having a more holistic approach in general. And you can kind of see that in how education's changing. There's more of a focus in teaching nutrition and kind of socioeconomic influences on healthcare. Um, I think historically DOs, it started back in, I think either right before or right after the Civil War. The guy, Andrew Still, that started DOs, he was a MD actually, during the Civil War, and he just kind of I guess, what he thought were inefficiencies or bad treatment techniques in MDs, and so he's like, oh, well, I'm going to start my own school. So he started DO school, and it's kind of progressed from there. Um, but the main difference nowadays and historically is that DOs, along with doing kind of the same things that allopathic MD physicians do in terms of, we have the same practice rights and can go into all the same specialties and stuff like that. Our medical schools, the same teaching. The only difference is that we have to learn something called osteopathic manipulative medicine. I think you have to do 200 hours, is the requirement or something at least. And so basically that's kind of like, it encompasses a few different techniques, but it's basically kind of, orthopedic oriented manipulation of the musculoskeletal system to help influence disease process. And it's mostly specifically, I think, applicable to musculoskeletal disorders. There's people that will argue that it can do other things, but I think it's more so helpful with MSK related stuff. And so it's, we do some techniques that chiropractors do. We do techniques that physical therapists do. And we do techniques that I can't remember what the other one's called, but there's a lot of other like treatment, kind of alternative treatment modalities that are kind of encompassed by OMM. Um, so it's a lot of stuff like soft tissue, kind of massage oriented stuff, myofascial oriented stuff, high velocity, low amplitude, which is more like what chiropractors do. And then my personal favorite is called muscle energy, and it's kind of a lot. They use it a lot in physical therapy. So that's kind of the difference. Is just that focus on kind of MSK treating, but most DOs don't even use that. I think it's like 5 to 10% of DOs use OMM after they graduate. So for the most part, it's not used.
Why do you think they don't use it? I mean, you spend all that time learning it, and then you don't. Do you find that? Okay? So, how many people that you've met in your school just went to DO school because they wanted to be a doctor, but they didn't really buy into the whole OMN stuff and the manipulation? Do you find that there's a subset of doctors that you're training with that don't buy into that part of it?
Definitely, for sure. I think most people that go to DO school are just people that are trying to get into an MD school and they just ended up getting to a DO school. I think it's probably like 10 to 5% of people that are really focused on becoming DOs. And I think a lot of that has to do more so just with exposure. There's more MD physicians than DO physicians. So you don't really know about DOs until you told me about it,
When I was in residency, DOs had their own residencies, like they weren't blended. And now, like you said, it's gotten so mainstream now that it's all the same. Yeah.
Yeah.
So, do you find that there are people like let's say in your case, you didn't know much about it. Do you feel like it's more of because I've heard one guy I was talking to say he kind of looks at it more as he doesn't really like the whole manipulation part, but he looks at it like learning medical history when he was in school. Do you feel like you'll use it in practice, or do you just look at it more as an interesting historical narrative?
Um, I'm definitely, I think I have some friends that are really into it and really buy into it. Um, and I think you have to look at it from a historical perspective and then kind of, I think, use critical thinking skills because it's hard to do research in those techniques because you can't really do placebo with it. So it's hard to kind of do the research. But I think there's techniques that, from a logical perspective, make sense in terms of how they would work. And there's just not a whole lot of, I guess, physiologic or anatomical evidence for a lot of them. Um, but I think there's some that personally they feel good to me.
Yeah.
And so I think that they're efficacious in that sense. And I think the way that I would approach it, I may use it. It probably won't be like a huge focus of my practice. But if I see somebody with something that I think I can help them out by doing it, then I'll do it. And I think for me, what it comes down to is three things. Um, can I, and I think this is how the approach should be: is it going to provide? Is there at least some perceived benefit that it might provide somebody? Is it going to cause harm? And then can I provide it at no cost to like a little cost? Because I wouldn't feel comfortable charging somebody a bunch of money for a treatment that's um, maybe not the most evidence based in a sense. And so I think if you can provide it to somebody without the risk of harming them, there's some type of benefit you can provide, and you can provide it at a fair price. Then I think it's useful. And I think there's some techniques that are better than others, and I also think it comes down to there's some practitioners that are better at using it than others because they do it more. So,
All right. So I guess let's say you were seeing a patient. Well, first of all, I kind of want to talk about what you're going to do. It's hard to know when you start medical school what you're going to do. Um, but you kind of started this whole process, I think, and maybe thinking you were going to do like neurosurgery or something, or because you had that neurosciences background, and you've gone through your first 2 years, which are basically didactic. You probably had some clinical stuff thrown in, but now you're in the third year where you're going through the different rotations, and you've done family practice, OB, psych, and now you're in peds. Um, where do you see yourself in residency? What are you thinking? It sounds good.
I mean, I think it's hard sometimes to know because you have such a limited exposure to things, and there's so
Mhm.
many different niche areas you can go into. So you kind of just have to pray that you get the right feeling or pick the right thing.
Are you worried that you might pick something and then like 5 years down the road, you're like, shit, I don't like this?
Not really, because I feel that I have a pretty good idea of what it is that I want to do. But and I feel like at the end of the day, too, it's I think people have this illusion that they're gonna pick this perfect job and it's
Perfect.
gonna make them happy and everything. All the troubles are gonna fade away. But I feel like for me, I want to do something that's fulfilling to me and I can help others with. But at the end of the day, it's a job too. I have to support myself and maybe other people at some point. So I just need to make money, at the end of the day to
Mhm.
live in a society like this. And so I think, there's going to be pros and cons to everything, but so I'm not really worried about picking something I wouldn't like. I think my interest going into school was always psychiatry, kind of just given my, desire to better understand myself and other people and my interest in philosophy. I feel like it was a good blend. Um, and so I think that's most likely what I'll end up going into. The only other thing I've thought of is anesthesia, just because I like the intersection between pharmacology and physiology. So I think that
And
anesthesia would be a
that's in
good.
psych too. I mean, there's a lot of that
Yeah.
in psych
hmm
for sure.
Yeah, you get that in psych. I think the biggest thing, the difference between those two is, continuity of care,
Mm,
and then procedures. So like in anesthesia, you don't really have patients,
right,
and then you get to do procedures, and then psych, you have continuity of care, but you don't. There's kind of becoming more procedures now, but they're not really done by a psychiatrist, so you don't
right.
really do procedures in psych.
Well, psych is getting a lot of cred now because of like the ketamine therapies and
Yeah.
DMT and the mushrooms. And I mean, I think that's going to
Yeah.
revolutionize psych.
I think that's what's really exciting about psychiatry to me is I kind of, given my philosophy interest and background, I like I feel comfortable and I like there not being a definitive answer to something. And I think that's something that a lot of people struggle with in medicine. I think a lot of people in medicine, they want there to be able to be an answer and end. They want to be able to do these labs and be like, okay, this person has, some type of kidney disease, and this is how I'm going to treat it. And it's very, algorithmic in a sense. I think psychiatry is a lot more open in terms of what you can do. There's definitely evidence-based medicine involved in
Mhm.
algorithms to treat them, but I think there's a little bit more of an art to it. And I think that there's just a lot of development that's going on, kind of like you were talking about with things, like, ketamine therapy and transcranial magnetic stimulation and stuff like that. And I honestly think in the next like 50 to 100 years, as we come to learn more about the human brain, I think psych's going to really explode and expand, and we're going to be able to do a lot more and understand a lot more. Um, and so I think that's what's exciting about it to me is psych is kind of the new frontier of medicine. I think there's a lot of room for creativity and research and innovation, and that's kind of what excites me about it.
I heard you mention at one point too, maybe forensic psych and kind of dealing with the people that have, you know, damaged brains, I guess, if they're killing
Yeah.
people and whatnot. But, trying to understand how somebody that goes from being a normal 5-year-old kid to a serial killer or something like that. I mean, that's what person doesn't watch those types of shows on Netflix or Mindhunter? I mean, it's a fascinating area to think that you could maybe intervene. But like on that note, when I did my 4th year, I was pretty sure I was going to go into cardiology or gastroenterology, and I had my whole 4th year set up. I did all the electives, and then I did an ultrasound rotation, and I really liked the ultrasound stuff. And then I said, I don't. I really liked the other residents that were in OB, but I think I was just telling you maybe months ago, I didn't really feel like I truly found that enjoyment piece that you were just talking about until about 3 or 4 years ago, when what I found was it wasn't the delivering of babies. That's a fun thing and it's always usually uplifting, but it was being up all hours of the day for 20 years and covering 10 other doctors, it just wears you out. And when I can sit down and talk to patients, and I like the surgery aspect, because in my brain, if I find a problem, I want to fix it. Like, I want to get in there and
Hmm.
fix it. um, and medicine isn't like that. Usually it's like, hey, take this medicine, come back in 3 weeks, and we'll see if you're better, in internal medicine. So that didn't appeal to me. But I think, and the other thing I wanted to bring up, there's this concept of the wounded healer. And you mentioned this, like, maybe we go into things because we have our own wounds, and we're trying to fix those things in ourselves when we go into medicine. So, like a classic example would be, like, I had a friend who was a type 1 diabetic. He was diagnosed when he was 6, and he went into endocrinology. I mean, that's pretty obvious. Or somebody that has seizures as a kid that goes into neurology. So I think it's interesting that you are looking at this as a way to, because if you go into psych, I think psych residents have to do therapy. I think that's part of the training, is you have to have your own therapist and go through that on your own. So that definitely won't be a bad thing. The thing about psych too, that'll be great. Most psychiatrists are based, they don't do insurance, which I think is very constraining in our current system. I do think it's nice if you can do some insurance to help people, but truth is, insurance plans don't really put that much emphasis on it. So, do you think that you would stay in Texas, or do you look at residency as a way to go live somewhere else that you haven't been before?
Uh, yeah, I mean, I'm not opposed to staying in Texas, but I'm not opposed to going somewhere else. I'm not somebody that I feel like has to be, super close to my family.
Well,
Then
that's
there's
nice.
not anywhere.
Thanks for that.
Not, not
You're
because I don't want
independent.
to, but
Yeah,
it's
you're
just,
independent.
yeah, yeah. And there's not anywhere I'm dying to live. I think, funny enough, I was looking at psych residency programs earlier today, just on the computer. And I think for me, it's more so finding the program that I feel like will help me achieve the career goals that I have. And a
Are there
big one
different? Do
for
different
me,
psych programs have different focuses?
yeah.
Functions?
So so there's certain psych programs that have a more of a focus on psychotherapy.
Oh,
Um,
okay.
I think people have this idea that that psychiatrists are the ones that sit down and do talk therapy with people, and that used to be the case kind of back in the day, but that's not really true anymore. But some psychiatrists still do that. But you have to kind of pick the right program that integrates that into the curriculum.
Right.
And then you also have to kind of continue on with training about in that after you or while you're in school, like either with like a institute or after you get out. And so I'm trying to find programs that have a strong focus in psychotherapy and specifically a strong focus in like psychodynamic, psychoanalytic psychotherapy, which is kind of it's not necessarily like what Freud and Jung did, but it's kind of more along those lines.
Would you say you're going to
Psychoanalytic.
be more psychoanalytic versus medication based?
I blended both, so I think so. Like I think what I would do is if I could draw up my dream practice or what I would like to do, I would maybe do some inpatient psych dealing with higher acuity stuff where I'm doing more like psychopharmacology, straight psychopharmacology. I would have private practice where I'm doing lower acuity patients that, maybe some of them aren't on any medications and some of them are. So my, the way I would do my meeting, like let's say I have a 1 hour patient meeting out, the first 10 minutes would be discussing how the medication is working for the patient, if we need to change anything, try anything different. And then the next 50 minutes would just be kind of, more like psychodynamic, psychoanalytic psychotherapy. And that's what I would do for my private practice. And then on top of that, or at some point, I transition out of inpatient to private practice, and then like on the side, I do consulting for forensic psychiatry. So that's kind of what I envision myself doing, and so that way I kind of get to do the inpatient and get to kind of the excitement of doing high acuity care, and then get to do the have the ability to do private practice and the freedom that comes with that, and the ability to do psychotherapy, which is something I have a strong desire to do, and then the ability to kind of do the forensic psychiatry, which I think would be stimulating and fun as well.
Well, I know you have to study, so I want to ask you one last question. Now, as a medical student, it's pretty common for you to diagnose yourself with some sort of disease process, I want to know what cancers you've had over the last 2 years. Uh, what what have you diagnosed yourself with over the last couple of years since you've been in medical school? And somehow they magically got better.
Most of my stuff has been because I have hip problems. It's not like anything serious, but it's more so just annoying. So just kind of like, especially with my DO background, trying to figure out what I think that is, whether I think it's some issue or some hip issue. I think at one point I thought I might have ankylosing spondylosis or whatever it's called.
Yeah.
Like an autoimmune condition.
Yeah.
Because you know, just different. I'm in the age bracket for that and stuff like that. I don't think I have any of that stuff. I think it's mostly just MSK based. I'm supposed to go get a ultrasound, testicular ultrasound, because I'm pretty convinced I
Yeah.
have varicocele
Well, you had testicular cancer
or
at one point.
testicular cancer or
Yeah.
something. So,
And
which
then
I'm in the age bracket for that. So,
yeah, but I think you also had colon cancer at one point.
yeah, maybe not anymore though.
It's pretty funny. It's like that. I think maybe it was a blessing for me that I went into women's health because I can't get any of those things. But yeah, you do go through it. And when you know a little bit about something, and you know all the, it's like looking on Google and yep, I got that, I got that, I got that. It must be whatever. So,
But I
well,
think it's hard. I
go
think
ahead.
it's hard too because you read about it in the books, but then once you start going out to clinics in your third and fourth year, and you start seeing actual patients with actual issues that are, maybe closer to your
Yeah,
age or
yeah,
around
yeah,
your age, or, you see, I did a rotation for 2 weeks and I saw, 40-year-old, 30-year-olds getting, these rare cancers or
yeah.
just getting cancer in general. And so it's kind of, it just makes you think of like, oh, young people can get cancer and, why, it could be me type of thing. And so I think it's hard when you start seeing all these sick people because you get worried about it, but then you also have to realize that you're seeing sick people because you're, being a doctor. And so that's the people that are coming to see you are people that have issues. It's not maybe super representative of the general population, obviously.
No, it's also tough when you have kids because your kid will have a fever and you'll immediately go to, I would always think it was meningitis. It's like,
Mm-hmm.
it's like, no, they could just have a virus and they're fine. But yeah, it's really tough sometimes. But the nice thing is you have colleagues that can usually talk you off the ledge or something like that. So I know you
It's
got
the
to go back.
burden of knowledge.
It's the burden of, I always say it's the burden of having a little bit of knowledge about once you learn more. But I don't know how people do oncology as a lifelong endeavor because you're around sickness and death all the time, and you must have to have either some way to detach from that, because I mean I can't imagine you don't take that home, or you have to have a buffer, because otherwise, like you said, if you're constipated for 3 days, you think you have a colon blockage or something. And I really don't. I'm glad those people are out there doing what they do, but I don't know how they do it, to be honest, without just, not sleeping every night. But I know you got to probably study, but thank you very much. I love you like a son. I do. I really do. And I'm
Love you
really
too.
proud of you for what you've done and your persistence, even from growing to 6'2" and medical school, and for being, as I said earlier, the most adaptable kid, because you really did roll with the punches. And I think I've always sort of said, if you can raise your children and not put into them your own pathologies, then I think you've done a good job. And I do think you probably have some of my pathologies, but hopefully they're not too bad, and we can recognize those. I love you, man. Thanks for coming on.
Love you too.